I'm Joe Chile. You can listen to me mornings on the Big Weck. Joining us today on the Big Weck's Buffalo on the Rise is Dr. Kaplansky. How are you today?
Good. How are you, Joe?
Thanks for joining us. I appreciate it. You know, one of the things that I noticed when I was prepping and doing some of the research for the show itself is the fact that there are a lot of national firms. There are a lot of firms that come in now and they're advertising in it. And you know, I always wonder, I like to have local people that I can call on. If I have a dentist, I want to go to the same dentist all the time. I don't want to go to, you know, the dentist of the day, right, if you will. So what sets you apart from like the national firms?
Well, absolutely. So there's a big move in dentistry now is to consolidate, and basically dentists are selling their practices to larger companies. They're called DSOs. And most of the offices that you see out there, even though they might say Dr. So-and-so, they actually are part of a huge conglomerate, and it's a big corporate organization where profit is the most important thing. So we are a privately owned, very personable, and local dental office. You always see the same people when you come, and we take good care of patients.
What do you think, you know, we know that you're in Gasport, and to some people Gasport may seem like it's a way off or whatever, but you have people from all over Western New York and Southern Ontario coming to you, right?
Absolutely. So Gasport, obviously not the center of the universe, and many people don't even know where it is, but the services that we provide, the process that we invented, and what we do for these patients is so unique that people have absolutely no problem traveling to us from Toronto, from Erie, Pennsylvania, from even Albany.
You say that you can have dental implants in less than a day. Now, is that really true? Less than a day for dental implants?
It does sound sort of magical, doesn't it?
It does.
Yes, the process is really unique, and it uses patients' native bone or native tissue, so we don't rely on grafts. And by doing that and placing implants strategically and kind of joining them together with prosthesis as a brace, we can load these implants right away and give people teeth within 24 hours.
How long did it take you personally to get to the point that you are now, to the teeth now process?
Well, I've been a dentist for 30 years, and I've been in practice in New York for 25 years. And it's pretty much a lifelong journey for me. And every year I just get better, like that wine or cheese.
And there's nothing up your sleeve, right? I want to make sure we're talking about, you know, a magic here and things like that. It is a revolutionary process. Now, it is, you know, you talk about this happening in less than a day. Yes. Traditionally, when we're talking about dental implants, is it something that can take weeks or a month or whatever?
Traditionally, it can take months, sometimes years. So let's say a person doesn't have teeth anymore, and they have deficient bone. They have not enough bone. They would come to a doctor and they would say, well, you're either not a candidate for a procedure or you will require grafting. So grafting takes sometimes months, sometimes years. Patient doesn't have teeth all that time. They just go in toothless and they're undergoing grafting surgeries. Then after grafting, they would attempt to place implants. A lot of times the grafted bone isn't as strong, so the implants cannot be placed. So then you already wasted a whole bunch of time. You wasted a bunch of money. You had no teeth all this time, and now you're stuck with the denture anyways. So a lot of patients experience this kind of a cycle of okay, I'm not getting anywhere with this. I just spend a lot of time and money, and I'm back to where I was with the denture.
Now, when you're talking about dental implants, because I grew up, not that I have dentures, but I grew up in the age of dentures. And there was, you know, you just see people, corn on the cob, pushing it out of the way. Apples, pushing them out of the way. Caramels, pushing them out of the way. Dental implants, can you eat all those things?
You can eat anything. With dentures, you're relying on adhesive. So a lot of people buy denture glue by a bucket, literally, and they put it in there, and the denture comes loose while they're chewing. They have to reapply the adhesive a few times throughout the dinner, throughout the meal. Dental implants, the way we do it, pretty much gives you a chewing power when we're done, when the process is all finished. Not only identical to natural teeth, but sometimes even stronger, even better. We measure their bite force, and there's actually an appliance that can measure the bite force. And their bite force is tremendous. They can bite through anything.
I think there were women in my past that really wanted me to fall asleep and then put that adhesive on my mouth so I didn't talk anymore. I don't say that that works successfully. Some people are told that they're just not a candidate for dental implants. Well, what's your response to that?
Most of the time we say, yes, you are a candidate. So the way it works again is we place implants into patients' native bones. So most patients that have been told that they're not candidates, the dentist only looks at the area where the teeth would go. We go to the other areas in the face, such as zygomatic areas, which is a cheekbone. There's an area behind the jaw on the upper called pterygoid plate. There's also areas inside the nose that can be used. There's called transnasal implants. So we can do all these things. I'm pretty much the only dentist, the only oral implantologist in this area that is qualified to perform these procedures.
Well, for more information and answers to your questions, contact Dentistry by Dr. Kaplansky by calling 716-772-7500 or go to drkaplansky.com. Promotional and sponsorship consideration provided by the following: